So perhaps we could start, and if you'd like to formally say who you are, and then I think you're going to give us a statement, are you? Are you going to tell us a bit about what you're doing?
I could.
And why you're interested in this
Sure.
subject? That would be very helpful. So perhaps if we could start, and you perhaps could do that.
Fine. So I'm Jesse Olszynko-Gryn. I'm a Wellcome Trust Research Fellow at the University of Cambridge in the Department of History and Philosophy of Science, where I also did my PhD. The PhD was requested as evidence by the MHRA investigation to Primidos, which is because of one of the chapters in it that investigates the history of hormone pregnancy tests. And that's the point at which I became more involved in the MHRA review and the campaign, and decided that yes.
Sorry, can I ask you to speak up a little
sorry,
bit?
yeah,
Because
okay.
I've
Yes, a lot of ventilation.
I know it's a bit difficult.
Okay.
But
So,
I
yeah.
should also have asked you whether you have any declared interests in terms of sponsorship or anything like that, or any connection with Primidos.
No, I mean all the research is funded by the Wellcome Trust, but they're pretty hands-off. So,
Right.
So the PhD I completed in 2014 is a history of pregnancy testing in the UK that focuses mainly on urine pregnancy tests from the early 1900s until the present day. So, and that's the book that I'm currently writing. And so that's how I found out about Primidos and other hormone pregnancy tests, was doing archival research, including at the Sharing Archives in Berlin and at the National Archives at Kew, so about 10 years ago. And really until the sort of more recently, I didn't really know what to do with that information. And when I talked to other historians about hormone pregnancy tests, usually they didn't believe me, or thought it was sort of a, kind of really strange story. Because until, I think especially the Sky News reporting and the MHR investigation, nobody had heard of these, or very few people outside of those immediately involved had heard of these tests. And it just seemed to most people today like a really unlikely product. So using one of these hormone pills for pregnancy testing. So I kind of sat on the research for a while until I saw, I think, a news report showing some of the campaigners at the same archives I visited, looking at the same documents, and then I really didn't know what to do as a historian, because I'm used to just going and looking at archives that nobody else cares about, and then just taking my time, writing articles and books without this kind of pressure of a kind of interested review or inquiry. So in the last 2 years, I prioritized. So Primidos moved up in terms of the it moved up my to-do list, and I got and then I managed to convince some other historians that I knew already in Sweden and Norway and Finland, and now West Germany and hopefully Spain and Italy and the Netherlands and Belgium, to also do the same kind of work I was doing, which was to reconstruct the history of the marketing and the regulatory processes around hormone pregnancy tests in those countries, which weren't particularly coordinated in the 1970s. So, and that's an ongoing project. So in terms of, just to wrap up where I'm going next, I was recently hired as a Chancellor's Fellow at the University of Strathclyde to start work in January at their Centre for the Social History of Health and Healthcare. So I'm starting this new position in January, and then I'll be in a position to sort of apply for more funding from the Wellcome or other sources to continue this work with my European colleagues, because it's timely. Obviously, it's of interest now to people like yourselves, but also from a historical and intellectual perspective, it's an extremely fascinating story that deserves to be investigated more deeply than it has been so far, and has all sorts of consequences, I think, for the historical understanding of thalidomide, of stilbestrol, diethylstilbestrol, teratology, and generally the science and public culture of birth defects and the media, and how sort of the public and scientific awareness of the relationship between drugs in pregnancy, risk, and congenital malformation has been understood in the 1960s, 70s, and 80s. So I think that would sort of doing this kind of work, this historical work that I'm doing with my colleagues, I think will potentially complicate and transform our understanding of this area, which I think to date puts a lot of emphasis on, it kind of begins and ends with thalidomide, as if that was the whole sort of 1960s, thalidomide happened and we all learned our lessons, and that was it. And in fact, probably the truer but much more complicated story is, would involve really reckoning with the history of these kinds of products and other kinds of drugs as well. Sorry if I rambled on a bit. I hadn't prepared a statement. Maybe I should have.
Well, with Primodos that there's really been a very long history about all this and what has happened in the past. And I just wondered if you actually knew if there were any options for pregnancy testing between 1950 and 1980, and whether there were costs associated with that and the sort of time taken.
Yeah, so one of I don't know if you've seen the article that I co-authored that came out a few weeks ago in Biomedical.
What was the title?
The title was A Historical Case for Regulatory Failure.
Yeah.
Okay, good. So that's, so I tried to get that out in time for it to be taken into consideration by this review. It's published.
Submitted it as evidence.
Yeah, okay. I wasn't sure if I'd submitted it on time or not. It's published in Reproductive Biomedicine and Society online. So in that article, I tried to put all the kind of relevant information I had at the time in terms of alternatives that were available, and cost factors, and that sort of thing. And that's, I guess, in terms of what history can and can't bring to the table. I think sort of work that other people are doing on laboratory animals or epidemiological work that's reanalyzing data is sort of something that I'm not qualified to do myself or comment on expertly. On the other hand, in terms of providing a context, especially regarding alternatives that were available at the time, I can definitely do that confidently because I've been working on this for 10 years now, so if that's what you want, then I'm the right person to answer that question. There were definitely alternatives available at the time, and that's, I guess, one of the reasons why the case is so interesting. The case of Primodos, it's so interesting and so in some ways infuriating because not only were completely harmless and fairly cheap and reliable and practical alternatives widely available in this and other countries, but the fact that they were available was widely acknowledged at the time, privately and publicly, including by experts that were directly involved in the regulatory decision-making processes around Primodos, and in terms of the marketing, sharing at the time also knew about Prognosticon, the first urine immunological test for pregnancy that came out in 1962, so the first test kit, and perceived it as a direct commercial threat to Primodos. Before that, sort of in the 50s, pregnancy tests were more cumbersome. They involved injecting, as you know, toads with urine and then seeing whether or not they laid eggs or emitted sperm. And although highly reliable, those tests were expensive and required access to a laboratory. GPs had to send urine specimens to the lab and get samples, get a lab report back and see the patient again to deliver the results. So sending patients home with a couple of tablets was more convenient, especially for overworked, busy GPs. And they were cheaper. And there's a kind of more complicated story about the fact that tablets as medications were reimbursable on the NHS, whereas laboratory tests weren't. And throughout the 60s, GPs were petitioning the Department of Health to try to make it so that they could be reimbursed for doing kind of on-the-spot 2-minute pregnancy tests, which were in circulation by the 60s, but because of sort of the intricacies of Ministry of Health or Department of Health bureaucracy.
So I hadn't realised that. You say that they were paid for using Primodos.
No, they were able to get they were able to claim it back. My understanding, they were able to claim it back on the EC10 or the forum.
FP10.
So, yeah.
Was that not only if it was not indicated as a pregnancy test? Because my understanding, and I may be wrong, is that if the form indicated that it was to be used as a diagnostic test, it wasn't reimbursable.
I think, yeah.
But if it didn't indicate that, then it was reimbursable. Does that sound correct?
That sounds, I think that changed in the course of, I think initially.
When did it change?
I don't know precisely, and I think it's tricky to reconstruct. It might be possible to get a more precise timeline for that. And whether or not how that operated in practice in terms of whether doctors, it's not clear to me how closely the actual practice mapped onto the regulatory regime or the reimbursing. So, and regardless, I think, I'm just checking my slides now for the cost. I think Primodos sort of around 1960 was 5 shillings when you have a slash with 5 shillings on the NHS. So you have to convert that to decimal, I guess. But whereas a hog bed,
25p.
The toe test was at the same time roughly. The Family Planning Association was doing them for 25 shillings, so 5 times the cost.
And it required sending off stuff. So
there's more, and Murray Stokes and FPA by 1965 were charging £1 for a urine test. Private labs charged £2. Predictor, the first home test that came out in 1971, cost $1.75. So I think, I don't think it's the only factor, and a lot of the women who took Primodos say that they were given free samples and that I think was a fairly widespread practice, sort of leaving. So I don't think that's in contention, but I think it's one of many factors that made the hormone tests seem more appealing than the animal tests at the time. Although I think the really crucial thing that I try to map out in as robustly as possible in the article, and one of the reasons I read the article is just so that if you need kind of that information, I can just do it. It should be in there, and if you want me to submit further clarifications in writing, I'd be happy to do that if there's things that aren't clear in the article, like this question about reimbursing, which I did.
It's one of the things that I've struggled to get a very clear timeline on, and I'm glad you're struggling with it too.
I think I fudged that a bit. I wrote it was initially reimbursable in the NHS because I think that did change at some point, and I wasn't sure when, so I kind of wanted to leave that a bit intentionally vague. For some of the other points, we have a clearer timeline for. And I don't know if it's an important detail. It might not be decisive for a lot of things. But in terms,
can I just check this prognosticum, which you say was the first of its kind on the market? That was 1962.
Yeah.
That was obviously not available to women to just go to a chemist to do for themselves. It had to be by GP. The GP had to give them the test kit.
Okay, so the timeline for that is yes. Until 1965, when private commercial laboratories in London and other cities start to serve women directly as clients, and they take out advertisements and classified ads, and even put ads in the underground and on bus stops, sort of on buses, on the sides of buses and in train stations, and they're charging about usually £2 for a test, which is quite a lot of money in those days if you talk to people who remember doing these. But they're doing a lot of business, and so from 65 again, there's a lot to, if you're a middle-class woman in London, you might be more likely to go to one of these labs. And if you're living in a village in South Wales, or, you might probably wouldn't know about them, and you go to your GP. In 1969, the Pharmaceutical Society changes its line and allows pharmacists, so chemists, to do tests, sort of backroom testing. So in the 70s, a lot of women will go to their pharmacy or GP or a family planning clinic.
Can I ask you then, are you talking about the GPs who are giving out these pills? Do we have any idea geographically whether there were clusters of GPs doing this, or was it across the country as a whole? Yeah,
it's across the country. I mean, I wish we had more detailed geographical data. I mean, it might be possible to reconstruct, and I haven't tried this yet with just the membership of the association. That would obviously, there's obviously a huge sampling bias, but at least it would give us some sense. And my sense from interacting with them is that they do tend to cluster like in South Wales, around Liverpool, Scotland, so maybe in more economically deprived, post-industrial areas. The data I have from published records is anecdotal, but there was a GP, a busy practice in Bristol that I mentioned in the article that preferred Primadose just because it saved them a lot of time, and they were dealing with 750 antenatal care patients, and they just decided as a matter of course to send their patients home with pills instead of doing urine tests, which they called cumbersome. And then in the Sunday Times, when they did a survey in 1975, found that 10 out of 12 doctors in South Wales were still using HPTs, which is also suggestive of a regional bias. But I don't know.
Sorry, are you linking it to the economic conditions of those particular places, or is that just a coincidental fact?
No, I think it's speculative. I think it's suggestive of economic conditions and more importantly, lack of access to laboratory services. So how near or far you are to a cooperative hospital laboratory. Laboratories by the late 60s, early 70s are also complaining of being overworked, and when they sort of pregnancy tests are the last thing they want to be doing. They think it's sort of fairly trivial and low priority, so if they can sort of get out of it, they will. And they're not dealing with, sort of people working in laboratories aren't at the front line and aren't dealing with anxious women face to face and don't really see the need necessarily. I was talking to my German colleague the other day, and she has evidence that I think, in contrast to the UK, products like Primadose were being used more frequently in Germany, in West Germany, as an off-label abortion pill, because abortion wasn't legalized in Germany until much later. So in the UK it's quite early, in 67, 68. Although access to abortion was also fairly patchy, and so just because abortion was legal in the UK didn't mean that it was easy to.
So how did it become thought that a pregnancy test could cause an abortion?
Well, the way it works is by inducing menstrual-like withdrawal bleeding, which was from the beginning suspected as causing, in many cases, miscarriages, including,
But it wasn't marketed for that purpose.
No, it was never marketed, right, but we're in this different, I guess the really crucial thing maybe a historical perspective can bring to the table is the fact that, we're in a different world. If I could transport you back.
Well, you can, because I qualified in 1963, so I do actually remember it.
Right.
And social media didn't exist, so in that sense. So there must have been a conversation going on amongst young people at that time, including people my age, that this test, if you want to have an abortion, you should go and have this test done.
I think to qualify that, I think young, kind of fairly affluent people, especially in London, students. So, and I've talked to some people like that who do remember taking prima dose or amenorrhea forte because they thought they might be pregnant and they didn't want to be pregnant. They were hoping it would induce menstruation, and maybe that would be a miscarriage. But there was enough of there was enough room, enough uncertainty.
Do you know, is there any evidence that you've been able to come across that they would take the Primados as part of a campaign to induce an abortion? They might do something else as well as having Primados. See what I'm getting at?
No, I think
they might say take double the dose or take something else which might induce an abortion.
Yeah, that you get that also with the birth control pill in the Yupsi regime of where you take an overdose of contraceptive pills as an abortion pill that practice is used in several countries up until the morning after pill is put on the market.
What time frame are we talking about for that?
For
using the oral contraceptive as an abortive agent, are we talking 1960s to 70s or 70s?
Yeah, I'd have to double check, but yeah, but again, it depends on the country and how accessible these products are, and the national histories are very different. And it's hard to research if it's sort of an informal practice of taking an overdose that wouldn't have left a paper or explicitly not left documentation. It's going to be hard to reconstruct. I want to just be really clear that there is some anecdotal evidence, and I think practices like this were more widespread in countries where abortion to access was in the 70s was less available. So in the United States there's more evidence, and in West Germany in the 70s there's more evidence that these products were used in this way. In Britain there's also lots of anecdotal and published evidence that doctors were prescribing these products on good faith as pregnancy tests, and that women were taking them on good faith as pregnancy tests, and that maybe the more typical encounter in the UK in the 60s and 70s was for a woman to go to her doctor and say, I think I might be pregnant, and the doctor would say, okay, well, let's have a urine sample, or, well, okay, here are these tablets, come back and see me if you don't bleed, and then sometimes we'll do a urine test. So it was sometimes used as a screening test, as a preliminary test before ordering a more expensive urine test. And there was a lot of, there was a range of medical opinion on whether these drugs were potentially harmful or even beneficial. So because progesterones were also being used to prevent miscarriage in the 60s, there was a sense that depending on the timing and the dosage, they might even have a beneficial effect on an early pregnancy. So I really don't want my main intervention here to kind of give the impression that these drugs were being used primarily as abortion pills in the UK.
The reason to ask isn't that at all.
Okay.
It's so that we can interpret the evidence that exists relating the use of Primados to damage to the fetus, because was it likely that the woman was taking some other intervention at the same time?
One thing that I think should be done in terms of, if that's one of the remits of my of being able to be here, is I think it would be really helpful to systematically, and maybe you're already doing this, but interview and collect case notes where they still exist from the association members. It's a couple of hundred people, and it's a long time ago. Their memories won't be perfect. Some of them have recovered their case notes, others haven't been able to. And I think the evidence is not going to be, the data set's not going to be one that you could do kind of really robust statistical analysis with, but I think that'll help in terms of getting a qualitative sense, at least, in terms of how.
Do you think that they might be, do you think they would be representative of women taking it as a whole? Or do you think they might not be?
I mean, obviously, they're the ones who were pregnant and then gave birth to children with malformation, so they're not the ones who had negative results, who weren't pregnant or who miscarried knowingly or unknowingly, or who gave birth to perfectly fine children. So the other thing one of the things that kind of bugged me about the previous review, and in terms of just in terms of comparing the Prima-Dose users to other kinds of women and what other kinds of products they may or may not have been taking, it's an interesting question. I talked to women who it was their first pregnancy, they were hoping to get pregnant, they were married, they went to their doctor, as women were increasingly starting to do in the 60s and 70s when they thought they might be pregnant. Not to stop smoking or drinking, all that stuff comes later. So we are, in that sense, you remember, but a lot of this, it doesn't really start with thalidomide. It might start later in the later 70s in terms of with the kind of intense pressure that's now on women, even before they conceive, to radically modify their lifestyle and pay, and stop taking all medications and stop smoking and drinking. So we're in a different world, but there is, in the 60s, there is starting to be more of an incentive. Not yet, I don't know when sort of routine the 30-week ultrasound starts, but that's later again, right? So, but I have talked to women association members who did, and I believe them. I have no reason to doubt them that they were hoping to get pregnant. They went to the doctor, and were just sent home with pills. And then, of course, again, the other thing that's changed is people, maybe especially women, had a lot more faith in medicine in the 50s and 60s than they do now, and maybe they just didn't question, the potential risk of taking pills that a doctor gave them. And I think in a lot of cases in pretty good faith, and it depends who you talk to, if it's a GP or a pediatrician or an obstetrician or a teratologist or a geneticist. There's a really heterogeneous ensemble of experts that are looking at this at the time from very different perspectives and have very different ideas about what's safe and what's not safe, depending on their expertise and what kinds of cases they're coming up against. I talked to a pharmacist too, who's available for if you need more of this kind of evidence. It's hard to get these kind of data points because they're so. Aside from doing, I don't know how you did put out a call for evidence, so I don't know how many GPs or pharmacists from the 1960s responded. It's hard as a historian for me to get at those, especially, and they're crucial because this is you get the experts leave a paper trail. They're in the archive. We know what the experts said to each other because they wrote letters, and it's well documented in terms of whether they were concerned about miscarriage or birth defects or not. It's harder to know what rank and file GPs and pharmacists thought. The one pharmacist I did manage to talk to said he was surprised, when he got prescriptions for Prima-Dose, because he'd heard about the risks in the news, but he prescribed it anyway, or he assumed that any drug that was sort of potentially risky would have been sort of taken off the market after thalidomide, so he kind of prescribed it anyway, despite his own personal misgivings. I feel like was there a question that I...
No, that's fine, you've given me the answer. Not the answer I sought, but you've answered the question, thank you.
Can I say, I think we could continue this conversation for some time, but we've got other people coming today, so we need to be conscious that they're waiting, so we need to get them into the room. So can I thank you so much for coming? And perhaps, I'm pretty sure that there are other questions we might want to ask you. So if we could do that through other means, that would be really helpful. And you may want to ask us some questions.
Can I make one final point? I just remembered what, and it'll be very brief. Sorry for rambling. The one thing that hasn't been clear, that is unclear and hard to reconstruct, is so we know about the women who went to the doctors and took Prima-Dose because they thought they were pregnant, and maybe they were more or less anxious than other women who weren't prescribed Prima-Dose. So at the time, one of the estimates for 1971 is maybe 100,000 or 200,000 women in the UK were given Primadose as a pregnancy test, I believe. At the same time, just in terms of scale, about an estimated 1 million women were given urine pregnancy tests, so about 10 times as many, just in terms of very rough numbers. So it's not like the choice was between an anxious woman going to the doctor and getting Primadose, or a woman who's not anxious and just doesn't go to the doctor at all. 10 times as many women would have gone to the doctor because they thought they were pregnant and just been sent, given a harmless urine test. So that was increasingly the norm in the 60s and 70s, and already much more prevalent than the urine test, the hormone test. So I just wanted to
That's actually very helpful, because I was going to ask you, at what point did it sort of one outweigh the other in the timeline? So you would say early 60s, mid 60s?
I think urine tests were always. I don't think Primadose ever really matched urine tests.
So they were always a minority.
Yeah, and then as used in terms of being used diagnostically. I think in the article I have an argument about the fact that labs were in the 50s struggling to the demand was increasing and the lab supply was kind of plateauing, and I think then that's when companies like Schering saw that they could capture a small part of a growing market that labs were failing to meet. And once the 1962 test came out and allowed for the decentralization of testing, so that didn't have to be concentrated in these large centralized labs but could be done in every GP, surgery or pharmacy back room, then you really get an explosion in the number of tests being done. But even before then, it's probably hundreds of thousands, if not a million. Okay, thank you. Please do feel free to contact me. I'll be more than happy to dig, especially at the question others that you asked, to try to get a more precise chronology, which I think is an important thing to do.
Yeah.
But it would really help to have the. Yeah.
And let us know the change of your email address if you go to Strathclyde.
Yes.
Yeah, okay. Will do. Thank you.
And thank you so much for coming. It's been really helpful.
Thanks a lot.
And as I say, I'm sure it will continue
Okay.
to be in discussion. Thank you very much.